I don't want to die trying to give life.
Dying while giving birth or shortly after is a sad reality for many women in the United States. In fact, according to the World Population Review, Arkansas has the 5th highest maternal mortality rate in the nation. And when it comes to Black women, the numbers are even higher. In this Fox 16 investigation, I look into why certain women are dying while giving birth at a disproportionate rate.
Okay, man. Hey, baby.
Making daily visits to Baptist Health's neonatal intensive care unit is not what Jayla Robinson imagined.
And it just felt like, how does this happen to me?
But it's her reality.
I deflated because I just felt like 34 weeks is not what I prayed for. I did not want a preterm baby. I did not want the NICU experience.
At 32 weeks pregnant,
I ended up pushing up in bed trying to get on a pillow, and I felt / heard like a pop.
Jayla's water broke. That led to a 2-week stay in the hospital.
So I'm over here like, oh my gosh, what does this mean? Yeah, I'm 32 weeks. I've got 6 more weeks to go. I'm not ready for this.
This is Jayla's second pregnancy. Her daughter's delivery 3 years earlier was also a life or death situation.
It felt like an out-of-body experience. It was extremely surreal.
While in labor during her first pregnancy, she was rushed to an emergency C-section.
It got to a point of being critical. Thankfully, my daughter and I both survived that experience, but it was hard.
After her first pregnancy, Jayla became more aware of maternal mortality. That's when a woman dies during pregnancy or within 1 year of giving birth. According to the World Population Review, the United States has the highest mortality rate of any developed country. And this chart from the CDC shows pregnancy-related deaths have consistently trended up since 1987.
We were designed to do this. So why are we dying from something that we were designed to do?
And data also shows Arkansas is the 5th highest state for maternal mortality. A report from the Arkansas Maternal Mortality Review Committee found Black women are more than twice as likely to die from pregnancy-related causes than white women in Arkansas.
I knew that a lot of women die in childbirth. A lot of women that look like me die in childbirth. And you ask the question of, in 2023, why are we dying having babies when our bodies are supposed to do this on their own?
So we went to Baptist Health OBGYN Dr. Letitia Jones to ask that very question.
More highly educated Black woman was still more likely to die than a poor, not as healthy white woman. And so obviously there's got to be some implicit bias going on within our healthcare system.
The reason is multifaceted. According to the review committee, some factors are directly related to pregnancy, like a woman's health status, health behaviors, and access to quality health care. Then there are other factors like poverty, family and community support, and racial bias in policies, practices, and systems.
Any maternal death is too many, right? And the study also showed that some of those are potentially preventable.
In fact, the review committee found of the 30 pregnancy-associated deaths in Arkansas in 2018, 92% were potentially preventable.
So that hurt my heart and encouraged me at the same time.
Dr. Jones is passionate about fixing this problem. She has this advice for doctors and patients.
For physicians, still taking that time to listen to your patients, taking that time to take their concerns seriously. And then on the patient side, to take their advice. When I talk to my patients, I want them to leave understanding what I said and why I said it.
And that's exactly what Jayla did too. She asked questions and surrounded herself with a support system who would advocate for her and her child.
There are things that you can do to ensure that childbirth in 2023 is not a death sentence.
And the Arkansas Maternal Mortality Review Committee did make some recommendations to the state. One of the major recommendations is to extend maternity coverage from 60 days to 1 year postpartum, since 47% of pregnancy-associated deaths happen in that time frame. As for Jayla's baby boy, some good news to report. He was just discharged from the hospital over the weekend, and he is now at home.